removed under any conditions. I know all about living wills. I just lost my father a month ago, and I wish he had had a living will. It would have made life much easier for our entire family. So this is just a blatant campaign of misinformation that is going to create tremendous damage out there among people who are thinking about a living will and now are going to be scared that it's got something to do with euthanasia, and that's just not what a living will is about at all. There are provisions in the healthcare reform bill that would stop the overpayment of private insurers who are in the Medicare program who offer what's called Medicare Advantage plans. And the point here is to make sure, once again, that private insurers are competing on a level playing field with traditional Medicare, which many, many seniors have. And what we want to say is we don't mind if some seniors choose Medicare Advantage plans, but we don't think we should pay insurers 14% more to provide the same services to those seniors, because what you will end up with is the privatization of Medicare. So there is some cuts to Medicare Advantage to level this playing field. But there are not cuts to services in Medicare. There are not cuts to benefits. That is just, those things are not there. And there's a lot of misinformation. Those are actually 7 reasons. I kind of compressed a few, combine them a little differently. Why I am really, truly excited about healthcare reform. And among friends, I've tried to point out where I have concerns. And I think you have the handout that will help you, think about this. There's some nice numbers in there that I always need the cheat sheet for. Jessica, do you want to step up for a minute and talk about what we have available to help people who are going to go to August 17th, town hall, et cetera, et cetera? Come on up.
Thank you, Kathleen. And I want to thank each and every one of you for being here tonight, because I'm going to echo a lot of things that Kathleen said, but this is it. August is truly the month in the health reform debate. And as Kathleen said, there are 5 committees in Congress that have jurisdiction over health reform. 4 of them have passed bills out of committee. This didn't happen 15 years ago during the Clinton administration, but it just happened right now. So we've made tremendous progress, but the take-home message is that we still have so far to go, and there's still so much to do. And by coming out tonight, and by getting ready for the meeting on the 17th, you all are doing so much and making such a difference in this movement, and we really appreciate it. So thank you, and keep up the amazing work. There are lots of ways that Families USA would love to partner with you and support you in the tremendous work that you're doing. The first one is we have something called an August Recess Toolkit. And basically it is a one-stop shop for everything August recess. And I think one of the strongest takeaway messages we have is that there's absolutely something that every single person can do. Whether it's writing a letter to the editor, whether it's attending a town hall meeting, whether it's visiting with your congressperson or your senator, each person can make a difference in their own way. And this toolkit, there are so many different kinds of tools. We hope that there is something there to help everybody. You can access it from our homepage, www.familiesusa.org. It's pretty simple. You'll see on our materials. So if you want to write a letter to the editor, there's sample letters there. If you want to visit with your congressperson, there's talking points there. If you're going to go to the town hall meeting on the 17th, there's questions there that you can ask the senator. So we hope that you use it. Another thing that we wanted to alert you to is on something happening in Delaware on August 20th. So it's kind of a 1-2 punch, if you will. You have the town hall on the 17th, and then this is happening 3 days later on the 20th. Families USA is going to be releasing a report called Costly Coverage. And basically the report is all about how rising healthcare costs are placing an incredible burden on the backs of small businesses like Peter's and families. And if you're interested in co-releasing the report, if you're interested in learning more about it, please talk to Kathleen and I. We'll be happy to tell you more about it. But we hope that that's a nice 1-2 media hit for you guys here in Delaware. And the last piece that we hope will be helpful for the town hall on the 17th is something that Kathleen has been talking about. It is this piece called Responding to Attacks on Healthcare Reform. We brought 50 copies tonight, so I think most of you probably have it, but we also have it available on the website. And basically, if there are folks in the room who are part of the radical fringe, part of the AstroTurf groups, naysayers of healthcare reform, chances are you're going to hear some things in this pamphlet, right? We already talked about euthanasia. They're shoving health reform down our throats. Isn't this just socialized medicine? Well, this document teaches you how to respond to all those things, because we all know that they're lies, and just misinformation. And basically, the take-home is respond to those lies and pivot back to pro-reform messaging. So pivot back to Kathleen's presentation of all those wonderful things that are good in the bills. Don't get stuck in the muck of the lies, but pivot, twist back to the positive things in the bill, and quickly dispel the myths, because they're not true. And by the more that you talk about them, the more that you validate them and give credence to the other side. And what's most frustrating is that the radical fringe, they're just out there to kill health reform. There's not an alternative plan, and it's not policy or how it would help American families. Their goal is to stop health reform. And what's so frustrating is that families are hurting. We know in the last 9 years that premiums have increased 5 times faster than wages. I mean, how can family budgets sustain that? Small businesses are hurting. This is falling squarely on the backs of small businesses. And when you think of the American dream, you think of small businesses. And in many cases, this is a life or death issue. There are 22,000 people who die in the United States every single year because they don't have health insurance, and they wait too long to get the care that they need until it's too late. And for 22,000 people, they actually pass. So this is a serious issue. It's time to stop playing politics and solve our healthcare crisis. And thank you to everyone in the room, because you all are a part of that and doing that. Best of luck on the 17th, and Kathleen and I are here now to take your questions.
So I don't want to run over time, but Jessica, you can stay up here. Okay. We thought you might have questions. We can take questions that are very...
Collecting cards, giving cards. And so if you have a question, hold up your card, and someone's going to come around and get it.
And we can get into the nuts and bolts, or we can talk messaging. Whatever's useful to you all, doing the hard work out here.
What is happening on March 17th?
What is happening? My understanding, and I'll turn it over to our Delaware friends, is there is a planned town hall meeting with Senator Carper. Can anyone who's part of organizing that say, Darlene, can you come up and talk about that?